Assalamu alaikum and good afternoon from Malaysia. First of all, I want to thank the management of Health Services Academy Islamabad, the organizers of this international conference, and in particular to Professor Dr. Junaid Khan for providing me the opportunity to talk to this august assembly of academicians and healthcare providers. The topic for today is communication skills as the cornerstone of patient safety and professional excellence. Based on my personal experiences and literature review, I will focus on three areas related to this topic. Number one, relevance and significance of doctor-patient communication. Number two, how to teach communication skills to healthcare providing professionals, its contents and methods of teaching. And number three, how to assess communication skills in healthcare providing professionals. First of all, let me share a tragic incident with you. A patient jumped from the 7th floor of the hospital and committed suicide. It is a real incident. Why the patient committed the suicide? Patient was recently admitted and was being investigated for HIV infection. The house staff received the report from the lab and straight away informed the patient that he is positive for HIV infection. The patient immediately committed the suicide. Could this suicide be prevented? Probably yes, if proper communication and counseling was provided. Let me share with you another difficult situation. How to comfort an atheist grieving parent. That is a deeply painful situation, and it takes a lot of care and sensitivity to comfort anyone in that position, especially when faith or spirituality isn't a shared source of solace. I was in such a situation and felt myself so incompetent. When the grieving parent is an atheist, comfort should focus on human presence, empathy, and shared meaning, and not on religion. Let us talk about doctor-patient communication. Doctors with better communication and interpersonal skills are able to detect problems earlier, can prevent medical crises and expensive interventions, and provide better support to their patients. This may lead to higher quality outcomes and better satisfaction, lower costs of care, greater patient understanding of health issues, and better adherence to the treatment process. There is currently a greater expectation of collaborative decision-making, with physicians and patients participating as partners to achieve the agreed upon goals and the attainment of quality of life. What patients are looking for in doctors? The most chosen quality was ability to listen by 61%. 48% patients said clinical experience, and 45% of patients chose compassion and empathy. Doctor-patient communication is the exchange of information, feelings, and expectations between healthcare providers and patients, encompassing verbal and non-verbal interactions. The key components include active listening, empathy, clear expectations, shared decision-making, and using structured communication models like AIDET. I will go into a bit detail of these structured communication models. First such model is AIDET, a 5-step model to guide interaction. A stands for acknowledge the patient, introduce yourself, explain the duration of the visit, explain the plan, and thank the patient for their cooperation. Another such model is PACES. This is a patient-centric tool that stands for patient information, ask questions, check understanding, express concerns, and state preferences. We can generate a generic communication flowchart by adding AIDET and PACES. Number 1, acknowledge and greet the patient. 2, introduce yourself and your role in the management of the patient. Inform about the duration of the meeting or the visit. Present information. Check understanding. Express concern and show empathy. Explain the plan. Invite and answer the questions, and thank the patient. Let us talk a bit more about AIDET. Acknowledge, greet the patient by name or title, make eye contact, smile and acknowledge any family or friends present. Share your name and role. Explain how you will be involved in their care. Give a reasonable time expectation for the procedure or visit. Explain what will happen, what to expect, and answer any questions that patient may have. Provide contact information if needed. Thank the patient and their family for their cooperation and for choosing your facility. A bit more detail of PACES. Present information. The healthcare provider shares relevant information clearly with the patient. The provider encourages the patient to ask questions about their health and treatment plan. The provider confirms the patient has understood the information, and the patient can also check their own understanding. The framework creates a safe space for patients to express any worries or fears they may have. Stating preferences allows patients to communicate what is most important to them regarding their care and treatment decisions. Let us move on to the second aspect, which is teaching communication skills to healthcare professionals. The key aspects of effective communication, which all the teachers must know: the verbal communication, active listening. The doctor should actively listen to the patient's concern. Avoiding medical jargon to ensure understanding. Asking open-ended questions and encouraging the patient to share more details. Asking the patient to repeat information back to you to confirm comprehension using methods like the teach-back technique. Start with phrases like, Assalamu alaikum, I am Dr. Alam. How would you like me to call you? And ending with, are you comfortable with this plan? And what questions do you have? The non-verbal communication is even more important than the verbal communication. Body language must show a sportive posture, making eye contact and nodding to show interest and empathy. Facial expressions must convey warmth and reassurance. Touch, using a gentle touch to convey care, though this can vary depending on cultural and personal preferences. Here is another example: breaking bad news through role play. The goal is deliver information clearly and compassionately while providing emotional support. Doctor, I'm afraid I have some difficult news. The results show that the cancer has spread, and at this stage, it's not curable. I know this is very hard to hear. Patient, so there is nothing that can be done. Doctor, while we can't cure it, we can still do a lot to help, to control symptoms, keep you comfortable, and support you and your family. We'll go through all your options together, step by step. The key strategies are: use a private, quiet space, a spikes protocol. Pause after breaking the news, allow silence. Check for understanding and emotions before continuing. And here is the details of spikes protocol to break the bad news, which consists of 6 steps. Setting. Prepare for the meeting by ensuring a private and comfortable setting, and ask if the patient wants a family member or friend to be present for support. Before delivering news, try to understand what the patient already knows or perceives about their conditions to avoid repeating information or talking down to them. Ask the patient how they would like to receive the information. Some may want all the details, while others may prefer a general overview. Start with the warning shot to prepare the patient, and then deliver the information in clear, simple language in small, manageable chunks. Check for understanding frequently. Acknowledge and validate the patient's emotions. Empathy is crucial, as patients may react with silence, denial, or crying, or it is important to provide space for their emotional response. Summarize the discussion and outline a plan for what comes next. This gives the patient a sense of direction and helps address any remaining questions. There are a number of communication barriers between doctor and patient, and it is important that all healthcare providers must know these barriers and address them. Health literacy variance. Patients have different levels of health knowledge. Telehealth and emails can lack personal touch. Unconscious biases from healthcare providers can affect interactions. Overuse of medical jargon confuses patients. Concerns about confidentiality can inhibit open discussions. Limited consultation time can hinder in-depth discussions, leaving patients with unanswered questions and physicians with insufficient information about patient concern. So therefore, before each consultation session, the physician must make sure that they have enough time available for the session. Diverse cultural backgrounds may lead to varying communication styles and expectations, creating challenges in understanding and addressing healthcare needs. Patients' anxiety, fear, or emotional distress can interfere with effective communication, making it challenging for doctors to gather comprehensive medical histories and provide necessary support. Let's move on to the next aspect, which is assessing communication skills. Segue framework is a research-based checklist of medical communication tasks. A recent survey indicates that Segue framework is the most widely used structure for communication skills teaching and assessment in North America. Data drawn from clinical skills assessments with standardized patients provide evidence of concurrent and construct validity. Analysis of visits between general interns and their patient reinforces validity of Segue framework in an actual practice setting. Inter-rater reliability is high when standardized patients are recording students' performance immediately after a live encounter, and when coders are evaluating videotaped or audio-taped encounters, intra-rater reliability is strong as well. The Segue framework has a high degree of acceptability, can be used reliably, has evidence of validity, and is applicable to a variety of contexts. The Segue framework consists of 25 items divided into 5 dimensions. Set the stage, 5 items. Elicit information, 10 items. Give information, 4 items. Understand the patient, 4 items. And the encounter, 2 items. With that, I end my presentation. I thank you for your attention.